You're watching CommonWell TV. We're in Orlando, Florida for HIMSS 2017. Scott Adams here with you as we're being joined by one of our member organizations. Right now, that's Athenahealth, and their Vice President, Jay Roxe, kind enough to join us. And Jay, let's dive right into it. Let's get a unique quality when it comes to CommonWell and Athenahealth that really kind of jumped out at you.
Sure, Scott. One of the things that I think really jumped out at us was scalability. And Athena is all about building the backbone of the healthcare internet, and the opportunity to get our almost 3,500 practices on CommonWell and get them connected right away was one of the real attractions of CommonWell.
So feedback-wise, what are you hearing out there with your CommonWell Association that you've had thus far?
Sure. I think we've heard that providers are really pretty happy. And they look at a couple of different things, both that degree of connectivity, but they're also looking to organize that moment of care and have the ability to get the records, but also the free text notes and the comments from the other physicians that they've talked to. And they're looking to us to take on work. So things like auto-linking, where if there's a 100% demographic match with other people on CommonWell, we'll automatically link those two records. So right now, about 38% of the records that we see get automatically linked together.
Jay, it seems like there's a lot of different directions that things could take in 2017. Sure. So with that, what should your vendors really be on the lookout for?
Absolutely. 2017 needs to be the year that we move beyond access to data. Data deserves to be free. Providers need access to the information that they need to treat their patients, regardless of where those patients come from or have sought care previously. We need to move beyond access to utility and performance, where utility is the ability of a provider in the moment of care to see the record and the notes about that patient, regardless of where they've sought treatment previously. And performance is the ability to draw insight from all of the data that we've brought together. So 2017 is about moving beyond access into utility and performance.
So CommonWell recently announced that it would be expanding its services. So with that, how will that affect Athena and its clients?
So we're actually really excited about two announcements that CommonWell has made recently. One of them is the new APIs that were announced, which I think are going to be terrific in terms of increasing that degree of integration and the ability of providers to know when new records are available or updates are out there. And we're really looking forward to working with CommonWell to integrate that into AthenaNet. Further, the announcement that CommonWell and Carequality made about bringing the two systems together and having the ability to exchange records seamlessly is going to be really important when we get back to that access point that we talked about, so that providers, regardless of what system that they're on, can get access to all of the data that they need to treat patients. So this is about moving from access to having utility and performance and moving back to a model where we can let doctors be doctors.
Athenahealth Vice President Jay Roxe is one of the proud partners of CommonWell. And for more on Athenahealth, make sure that you log on to athenahealth.com. And as always, you can jump on to CommonWellAlliance.org to learn more.